Have you had a wrist injury and your X-rays are all normal, but you still have pain? Do we need to worry about this? I'm Dr. Melanie, Amarasooriya, consultant orthopedic surgeon. One of the common problems that I see as a hand and wrist specialist is wrist pain with normal X-rays. I commonly see this problem in sportsmen and sportswomen and following injuries in young people between the age of 20 to 40 years. They often complain that they had something happen to their wrist, like they had a fall or they were playing and they injured their wrist and there was some swelling. Once they got the X-rays done, they were reported as normal. And this pain continues for months, most of the time when they're doing something, loading the wrist, trying to open a jar or lifting something, so this pain comes and goes. And at the same time, sometimes these patients complain of a clicky wrist or clunky wrist as well. But the problem is when they have normal X-rays and there are no fractures, there's no definite cause identified for this pain. But the important thing in this age group, especially in sports people, is ligament injuries that cannot be appreciated in X-rays. So if there is an ongoing wrist pain, a feeling of instability, clicky wrists or clunky wrists, I think it's important that we get it further evaluated. Sometimes it might need further scans like MRI scans, but my advice is to get that evaluated by a doctor so that we exclude these ligament injuries. The ligament injuries are not as common as fractures. When there's a ligament injury, the function of that joint is affected. It doesn't function as a normal joint. So what ligaments do is binding two bones together, helping them to move together synchronously. When there's a tear in those ligaments, this joint movement is affected. They don't move synchronously. So if that keeps happening for a long period of time, that leads to wear and tear changes. So it's always best that we intervene early. It might not need surgery, but it's always better to have that diagnosis and intervene early than late, because most of these injuries can be treated and managed effectively when they present early. Thank you.
Kings නිරතුරු විශ්වාසයෙන් ඔබ ළඟ රැඳෙන්නම්.